Hey folks, I come to you here from my place in New Hampshire on New Year's Eve. I wanted to wish all of you a wonderful, happy new year in the year coming. We're going to have a lot of exciting new products and ideas and concepts that I'm looking forward to share with you. I have not been actually making videos for a little while as I've been traveling, as many of you know. I went to Italy, as I shared that little video with you, and came back, went to Chile, came back, went to the Greater New York Dental Meeting, where we had a little soft launch of the TotalVac, which is this new irrigation system that we're going to be sharing with you in the year coming in the new year. It's basically a concept that uses negative pressure and positive pressure irrigation in a non-proprietary way by having kind of an open platform, and allows you to apply these concepts in a very inexpensive manner in your own clinical practice. I'm going to share with you a little video here at the end to showcase this concept of the TotalVac and what it does for irrigation, and it may be of some use for you. There's going to be an actual proper launch at the Chicago Midwinter meeting this year. It's going to be in February. Until then, please take a look at this video, and I wish you all a wonderful Happy New Year. I hope you guys had nice holidays also during the Christmas. You can see we still have the Christmas decoration up. I'm going to be taking that down soon as the New Year is coming, and I wish you all a great 2023 and many videos to share. In the meantime, I'm just going to share with you this video on TotalVac, and I'll see you next year. Hi folks, I'm excited to tell you about a new product that I've helped develop in collaboration with BrasselerUSA and Vista Apex. This product has been in development for quite a while now, and I've made many hints and references to it on social media, but here it is at last. Okay, the goal of this new device is to address our endodontic needs for suction during the access, irrigation, and instrumentation all in one kit. Basically, during a conventional root canal procedure, high-speed evacuation is used during your access preparation phase. Then surgical suction is generally used during your positive pressure irrigation. And then some clinicians who prefer to use large volume negative pressure irrigation, they use a whole other irrigation system for applying negative pressure that can then be used for achieving negative pressure deep in the root canal. Well, I'm very happy to announce that we're trying to solve the entire positive and negative pressure needs of the root canal procedure at these different phases by utilizing smart design to combine all of these three steps in one comprehensive kit called TotalVac. The TotalVac kit contains three main components. First, high-speed evacuation. This high-speed tip is used during the access preparation phase of the treatment and efficiently removes the coolant from the high-speed handpiece during access. 2. Surgical suction adapter. This adapter is applied to quickly turn your high-speed evacuation into a surgical suction tip. The surgical suction tip can be used for general suction needs during root canal therapy. This eliminates the need for an additional main suction tubing for a whole different surgical suction during the operation. 3. Negative pressure tubing. Now, this tubing is really the core and can be connected to surgical suction tip, or if you prefer free operation, you can also connect it directly into the main suction using the main suction adapter. The tubing splits into a manifold head for syringe irrigation and also a handpiece head that can accommodate different diameter suction tips for negative pressure deep in the root canal. The manifold head accommodates a side-vented long needle, allowing deep positive pressure irrigation while applying simultaneous suction. This 30-gauge long closed-ended side-vented needle provides the operator with one-handed irrigation deep inside the canal. By switching to a short needle on the manifold, negative pressure can then be applied in the canal while depositing irrigant coolant in the access preparation. By switching the flexible tip with the long needle, deeper negative pressure can be achieved in the final phase of the irrigation after macro debris has already been removed. These three components are the core of the TotalVac system. The TotalVac system allows the operator to address all the suction needs of the operation from access opening all the way to positive and the negative pressure irrigation needs and all the way into the drying of the canal for obturation. But more importantly, unlike other closed systems on the market using their own proprietary connections and needle tips, my vision for TotalVac was to make it an open source system allowing the operator to use their preferred needles and designs. This is why TotalVac uses the Lure Lock attachment, opening up to a world of possibilities for needle tip sizes, length, and tip designs based on the operator preference.
The TotalVac kit comes with all the items that you need for clinical operation, but it's incredibly versatile and you can use whatever system you want and you can customize it based on your own preferences and requirements. TotalVac is ideal for all operating environments, but it especially shines where access to a chairside dental assistant may be limited and one-handed positive pressure irrigation by the operator would be required. Please check out the TotalVac, and if you have any questions about this application or clinical use of it, drop me an email or write a comment on our social media channels and let me know what you think about it. All right, guys, good luck. And for Real World Endo, I'm Ali Nasseh, and let's save some teeth.